Welcome back. A Madison woman will need to go in for surgery in a few weeks for a second time for the same problem. She put off seeing a doctor until it was nearly too late.
Amanda Quintana shares her advice. Don't let COVID or thinking of others prevent you from getting the help you need.
It's another trend we're seeing as a result of the COVID-19 pandemic. People are putting off their pain or their medical issues, and now doctors here say they're seeing more people come in with their appendix already burst.
I was, living my normal life just with this ticking time bomb right in my stomach.
A bomb that Catherine Shane didn't realize would soon go off.
I'm like, oh, I don't want to waste anyone's time. It'll resolve itself.
When she couldn't ignore the pain anymore, Catherine finally went to the ER. Doctors explained her appendix burst an entire week prior.
It's something that I don't think we would have expected initially with the pandemic.
St. Mary's Hospital ER Dr. Kyle Martin says Catherine's case used to be rare, but not since COVID. And they're not just seeing this for appendicitis.
Strokes and heart attacks are two other scenarios where patients that may have had some, stuttering kind of symptoms earlier on, if we had investigated that earlier on, we could have prevented it to progressing to a larger event for our patients.
He says waiting often makes treatment more difficult and dangerous.
Mine had already ruptured and created this nice abscess full of infection. So they wanted to drain all of that out of my body before actually removing the appendix.
If caught early, Catherine likely would have been in and out of the hospital in a day. Instead, she spent 6 days there and now has to go back for surgery to actually remove the appendix. And as for COVID, she was never worried during her hospital stay.
All of the nurses and the doctors were wearing masks and face shields and gloves, washing their hands using hand sanitizer when they came in and out of the room.
Amanda Quintana, News 3 Now.
Doctors want to make sure people know that going into the hospital is safe. Patients with COVID symptoms are separated from others there at the hospital for non-COVID related medical issues before they even enter the building.